Hello, my name is Hannah Eigel. I am a nursing student in the ASN RN program at Vincennes University, and I'm currently enrolled in the Microbiology for Health Sciences course. Today we will be covering Pseudomonas aeruginosa, a multi-drug resistant opportunistic bacterium. In this presentation, we will cover bacterial characteristics, drug resistance, how the bacteria is acquired, symptoms, who the bacteria commonly infect, diagnosis, treatment, and prevention. In 1882, French pharmacist Karl Gessard first recognized blue and green pus on the bandages of wounds of soldiers. This description, detailed in his study on the blue and green coloration of bandages, was the first written account of a bacteria known today as Pseudomonas aeruginosa. The blue and green pigment was likely due to piocyanin, one of the many protective properties of Pseudomonas aeruginosa. Despite this bacterium's early discovery, P. aeruginosa continues to cause significant disease today. In the image on this screen, you can see the bluish-green pigment that's often associated with P. aeruginosa. Pseudomonas aeruginosa is a multi-drug resistant and opportunistic bacterial pathogen. It primarily causes infection, both acute and chronic, in immunocompromised patients. Infections from this bacterium can range from self-limiting folliculitis and swimmer's ear to severe respiratory infection, septic shock, and even death. P. aeruginosa is encapsulated, gram-negative, and rod-shaped. These bacterium are aerobic, meaning it lives in the presence of free oxygen. It is multi-drug resistant and opportunistic, which means it's often causes diseases in high-risk or immunocompromised individuals. In this image, you can see the rod shape of the P. aeruginosa bacterium. This bacterium can be found in a variety of settings, including water, soil, hot tubs, and swimming pools. P. aeruginosa can commonly be found in the hospital setting and is a frequent cause of ventilator and urinary tract associated infections. Pseudomonas aeruginosa has a number of qualities that contribute to it being multi-drug resistant. The outer membrane of the bacteria is made of both lipopolysaccharides and proteins. The lipopolysaccharide membrane not only serves as a protective barrier for the bacterium, but also produces endotoxins that can harm nearby tissue. The lipoprotein membrane effluxes harmful molecules as well. P. aeruginosa creates a biofilm which aids in its ability to be resistant to many antibiotics. This bacterium has a single polar flagellum that aids in motility in both aquatic and low viscosity environments. The flagellum swim towards and bind to epithelium cells by chemotaxis. P. aeruginosa also have pili that aid in motility by twitching, and these pili help to adhere to nearby cells. This bacterium also has a number of exotoxins that cause cell necrosis, damage the barrier of endothelial cells, and interfere with immune cells' ability to participate in phagocytosis. This bacterium has antioxidant enzymes that help protect it from oxidative stress once it is within the host. It also produces cytophores, which help to gather access to iron that's needed for this bacterium's growth and virulence. The symptoms of P. aeruginosa depend on the way in which an individual was infected. Individuals who acquire the bacteria in aquatic settings, such as a hot tub, will often develop folliculitis. Symptoms can include a rash, skin tenderness, or a fever. However, this form of folliculitis is often self-limiting and no antibiotics are needed. Another way individuals can become infected with this pathogen is from a puncture wound. An infection from a puncture wound can cause soreness and purulent drainage. This pathogen, as said, is opportunistic, so it is commonly the cause of infection in immunocompromised individuals. Individuals with cystic fibrosis, for example, suffer from an autosomal recessive genetic condition in which the cystic fibrosis transmembrane conductance regulator protein is not functional. This causes mucus, sweat, and digestive secretions to become abnormally sticky and thick, which causes frequent lung infections. Because of cystic fibrosis patients' susceptibility to bacteria growth in their secretions, these patients are commonly infected with Pseudomonas aeruginosa. In fact, 60% of adults with cystic fibrosis have been found to develop chronic infections from Pseudomonas aeruginosa. The antibiotic-resistant qualities of this pathogen can cause even greater problems for patients with cystic fibrosis, for this leads to chronic respiratory infections. Other immunocompromised individuals who are often affected by this pathogen include burn victims and individuals undergoing organ transplantation. In this slide, you can see an image of a lung that has been infected with Pseudomonas pneumonia. Diagnosis of Pseudomonas aeruginosa infection is typically completed by acquiring a sputum sample and performing a culture and sensitivity. If a bone infection is involved, a biopsy of the tissue or bone may need to be performed. Treatment of Pseudomonas aeruginosa infections typically depends on the type of infection that an individual has acquired. For individuals with swimmer's ear, acetic acid or a topical antibiotic, such as polymyxin, can be used. Polymyxin is bactericidal and it damages the cell wall of gram-negative bacteria, which Pseudomonas aeruginosa is gram-negative. Folliculitis, which is often acquired from hot tubs, is often self-limiting and no antibiotics are needed. Urinary tract infections are often treated with levofloxacin or ciprofloxacin. These fluoroquinolone antibiotics interfere with the DNA synthesis of the bacteria. For individuals with cystic fibrosis, the recommended treatment is inhaled tobramycin, which interferes with RNA synthesis of the bacteria. Healthcare settings can introduce a number of patients to Pseudomonas aeruginosa, specifically causing both ventilator-associated pneumonia and catheter-associated urinary tract infections. To prevent the spread of this infection, it's imperative that healthcare workers, caregivers, and patients are educated on the prevalence of this bacteria and the ways in which this bacteria are spread from one person to another. Healthcare workers, caregivers, and patients should be educated as well on ways to prevent the spread of this infection, such as keeping their hands clean by washing with soap and water and using alcohol-based hand sanitizers. These methods should be used for and during contact with wounds as well as with contact of medical devices. By combating Pseudomonas aeruginosa infections in the healthcare setting, significant strides can be made in overcoming this virulent and aggressive bacteria. Thank you.